Bismillahirrahmanirrahim. Assalamu alaikum. So it's a developmental station, cognitive assessment. And history for cognitive assessment, mainly it comes as autism, rarely ADHD. So first of all, hello, good morning. Me, Dr. Ruxana, one of child doctor here. Am I speaking to mom of Aisha? How can I address you? Aisha, thank you for coming. And I came to know that you have some concern regarding Aisha's development. Will you please tell me more about it? I'm so sorry to hear about it. So when you first notice it, does it change over the period of time? What did you do for it? Does she follow any kind, she's under any kind of team? And did she lose any of her skill that she acquired before? Does she looks like you, your family, or different? Do you have any concern regarding her behavior activity? Will you please describe her daily routine? I see. And do you have any concern regarding her hearing and vision? How many languages you use at home? Do you have any concern of having any ear abnormality or repeated ear infection? Okay, so now I'm going to ask about her past illness. Does she has any long extending illness? Any kind of hospitalization? Any kinds of bugs infection in brain? Any kind of head trauma, surgery? Any? Do you have any concern regarding her head size? And does she has any kind of skin pigmentation? Any swelling over the neck? Okay, so Aisha, now I'm going to ask about what she is able to do. So as she is 4 years of age, so do you notice that can she do the hopping? Okay, if it is not, then can she run? How can she run? Okay, and if she it is not, so do you have any concern that how she use stair for up and down? Okay, and then if you give her crayon, what can she draw? As she is 4 years of age, so I'm not telling, but can she draw the square? Okay, if it is yes, so great, but if not, then can she make a circle? If no, can she make a horizontal line? Okay, and if how many cubes she need to make a tower? How many cubes she knows to make a stair? And now I'm going to ask about your pregnancy period with Aisha. Do you have any concern this time? Do you take any alcohol, recreational drugs? I'm so sorry to ask about this. And will you please tell me the birth event? Okay. Now I want to hear from you the period after delivery. Did she need any kind of hospitalization? Okay. So will you please describe your family? Any history of similar illness in the family? What do you do for your living? Is it satisfactory? Do you need any support? Okay. What's about his schooling? What is the impact of this disease in your life and his life? What is your expectation from us? What is your biggest worry? Did she receive all of his jabs? Do you have any concern regarding his feeding, his growth? Thank you for sharing all this information with me. And this in this cognitive assessment, as we are doing the activities, social and speech and the language, so we will not ask the detail of how he play, because in the playing portion, social we can recognize it, so it's better to avoid. Just we will ask that do you have any concern regarding her behavior and activity? If it is yes, so we will ask the question in the another way, can you please describe her daily routine? Now the presentation. So the sequence we can remember that first of all the name and age of the child, then the main complaint, then the positive history, and then the family history, social impact, and other areas of development. Such like that, Aisha is 4 years of old child. Mom biggest concern regarding her behavioral abnormality, which she noticed for last 1 years of age, and she has very rigid routine, and she has a very tough perinatal period. There is a family history of no such illness. Socially, they are very much worried. And in the area of the other domain, is gross motor and fine motor is age appropriate. So I want to do the developmental assessment. The presentation in a very short presentation. And then the assessment portion. In the assessment portion, I will wash my hand and introduced with the mom, and taking the permission, I want to play with Maria. Okay, and then I will collect my developmental tools, and I'm looking for what she is doing now, and I'm looking, is there any dysmorphic face, how about her growth, is there any device and any hearing aid, does she is under any kind of stress or not. And I will enter the does she looks happy or aloof. Okay, I will enter the room in very sensitive manner, and does she aware of me that I entered the room. And first of all, I want to the hearing, speech and language, and I will go behind of her very sensitive manner and just whispering both of the ears separately. Hello, Maria. Hello, Maria. Does she aware of it? If yes, so I will come in front of her. If no, then I will say it loudly. Okay. And then after hearing assessment, I will come in front and I want speech of the language from the receptive language. From the receptive language, OP. O means order. So I will not tell in the assessments. So first of all, I want to assess how many orders she can carry. So for the checking of the first step of order, I will tell Maria, go to mommy. And then for second step, if it is positive, then for second step order, take the book and give it to me. Okay, and then I will appreciate. And I will, if it is positive or she is able to do so, I'll go the further 3-step order. Otherwise, I will just try 1 step and then stop. And then body parts. So I will take the Barbie. So where is the nose? Where is the mouth? Where is the ear? How many body parts does she know? So total number of body parts divided by 2 is approximately the age. Suppose she knows 5 body parts, examiner tell us 5 body parts. So we'll divide it by 2. So 2.5 years. Okay. And then I want to know that what action does she know? But checking it now, I will open the book and ask her, where is the car? I want to know about the noun. And then to know about the verb, I will say, oh, I will show her one spoon and one car, with which we speak. Okay, and to check the adjective, if it is positive, and that means more than 3.5 years, I will tell her to know the adjective. I'll show her a happy face and a sad face. Where is the happy face? And then to check the preposition, I will tell him put the ball on the table. And to make a complex preposition, put the ball beside the table. And then expressive language. Her name is Barbie. What's your name? She is 3 years old. Can you tell me how old are you? She comes from Dhaka. From where you come? Can you sing a song? Let's sing a song. Baba, black shepherd, happy when you full. During this, I will looking for any intonation, any echolalia present or not. And then I will check the what's count of I will check that how many counting. I will in that time I will open the book and ask her, what can you tell me what is happening here? I want to know how many words she knows, or how many words she needs to make a sentence. Okay, and then I will show my finger and tell her that, can you count just like me? 1, 2, and this. Okay, and how many? And I want to know how many, and let's check the color. I will open the book and look at the book. Can you tell me this color? And then after, and this express language, I'm looking for about non-verbal clues such as facial expression, eye contact, body posture, what's about the reaction. And then the social assessment, I will start from the playing. What she's doing now, she's playing with the card. Okay, I am imagining that she's in her solitary play. To check the imaginary play, I will tell that let's uh, give a drink to this Barbie. Will you give? And uh, does she join this imaginary play? If yes, then can you share toys with me? Sharing toy present or not? Which is 3 years, okay? 3 to 3.5 years. And after this, if it is positive present, then makes this fantasy play, and we will or a group play, or let's become a doctor and give injection to this Barbie. Will you? And after checking the playing, does she is with the nappy or not? And now I want to ask mom the question regarding the how can she fit, and how about her dressing, and how about what is about her toileting. And now the presentation. So today Maria is 3 years old, and she is dysmorphic and well grown, and she is non-dysmorphic, well grown, and non-cooperative throughout the playing, and very tough to retain the concentration. And there is in the area of the verbal communication, her receptive, she makes commands of 2 steps of command, and today she demonstrate. And she knows about 5 body parts, which 2.5 to 3 years. And in expressive language, her express, she only can tells her name, and there is echolalia is present. And there is a discrepancy between this language, and in the social there is only the solitary play is present, which is 1.5 years, and there is tantrum is present. And so together this my impression is the case of autism spectrum disorder. So how do we manage this case? So I will take I want to do the other developmental assessment of the other domain, take the history, detailed history, and general examination and other examination to rule out the risk factor, and refer him to CDC for further developmental assessment, and refer ENT audiology for the hearing assessment. And I want to go through multidisciplinary autism team um, autism team help, and what are the tools for autism diagnostic. It is the tools is the questionnaire, and there is AMJAC modified checklist for autism in total, and standard is DSM-5 criteria, and ADOS autism diagnostic observation schedule 2. And what are the team members of autism team? These are the developmental pediatrician, child neurologist, and speech and language therapist, child psychologist if needed, and cognitive behavior therapy. And there is occupational therapist, social service, educational healthcare plan, and if syndromic, then I will involve the genetics. And what is the role of cognitive behavioral therapy? It is start from the very early age of, and here there is intensive behavioral interventional course 40 hours per week. And is the role of SALT, teach parents to talk at home in a very easy way and give clear clues. And there is some there is help in articulation of words, and help in communication through both verbal and non-verbal cues, and help to develop in conversational skill. All of this will help the child to enjoy communication. What is the role of occupational therapy? Sensory processing disorder and comorbidity. When you involve the psychologist, tantrum, self-harm, aggressive behavior, sleep disorder. And is there any drugs for autism? There is no drugs for autism. If it is associated with ADHD, then we can give the drug for ADHD. And what are the association of autism? Autism maybe have any seizure disorder, ADHD, and some vision, hearing problems, sensory process disorder. Thank you. And what are the causes of autism? Idiopathic cause, some genetic cause such as the tuberous sclerosis, neurofibromatosis, and syndrome, fetal alcohol syndrome, Fragile X syndrome, Down syndrome, Rett syndrome, and it may be due to lead poisoning, maybe premature baby, family history of such illness, uh, and valproate intake, torch infection, and metabolic inborn errors of metabolism. So this all about the autism. Thank you very much. Assalamu alaikum.